Hello everyone, I am Dr. Anjum Rashid. In this video, I will discuss scarlet fever and I will start with a clinical scenario. A mother brings her 7-year-old son to the emergency department with complaints of sore throat and fever. He has symptoms for past 3 to 5 days. He is now developing a rash and his mother thinks his tongue appears more red than usual. He denies any cough, vomiting, diarrhea or dysuria. Immunization are up to date and there is no recent travel. He has decreased appetite but has been drinking fluids well and there is no history of recent illnesses. Physical examination reveals a developmentally normal young boy who is in no apparent distress. Vital signs are normal except for a fever. Now there is a diffuse fine papular rash with a sandpaper texture that blanches with pressure. There is bilateral anterior cervical lymphadenopathy, tonsils are enlarged, erythematous and an exudate is present. Tongue is red with prominent papillae. Cardiac and the pulmonary examination are unremarkable and rest of the physical examination is normal. Now the questions. What is the most likely diagnosis and how would this diagnosis differ from other exanthems or vasculitis? Question 2. What are possible complications and sequelae for this illness? Now answer to question number 1. This child has scarlet fever which is caused by an infection by Group-A beta hemolytic streptococcus, but it may also be caused by Staphylococcus aureus. Scarlet fever may be differentiated from Kawasaki disease by the absence of ophthalmological symptoms and edema of the extremities. Now the rash in scarlet fever will also desquamate during the course of disease, and Pasteu's line, which is a sign of streptococcal infection, may also form in the skin creases. Now Epstein-Barr virus is also considered in the differential diagnosis of fever, malaise and a papular rash. Scarlet fever is a clinical diagnosis, although confirmation of streptococcal pharyngitis may be obtained. Now Group-A Streptococcus is sensitive to penicillin, which is the first line therapy. However, penicillin allergic patient can be treated with clindamycin or azithromycin. Now answer to question number 2, which was what are the complications and sequelae of this illness? This is most cases of scarlet fever resolve without complications with appropriate treatment. However, certain serotypes of Group-A streptococci are rheumatogenic and may cause serious complications like rheumatic fever and glomerulonephritis. Other complications of scarlet fever include peritonsillar abscess, pneumonia, septicemia or meningitis. Thanks for watching. Please subscribe to my YouTube channel.